Hello everyone, we're Group 3 and we're here to present Dorothea Orem's self-care deficit theory and a case scenario on how we applied it in nursing practice. Before we proceed in discussing the theory itself, let us give you a little background about Dorothea Orem. Dorothea Elizabeth Orem was born in Baltimore, Maryland, in the United States of America in 1914. She was one of the leading nursing theorists in America. She was able to obtain her diploma, Bachelor's of Science degree, and Master's of Science degree in nursing from 1930 to 1946. She developed the guides for developing curricula for the education of practical nurses while working at the Office of Education in Washington, D.C. She led the Nursing Development Conference Group, in which all members contributed to the development of the theory. She opened her own firm in 1917 and published the book Nursing: Concepts of Practice, which was revised and published again in 1980, 1985, 1991, 1995, and 2001. She retired in 1984 but still continued to work collaboratively with others to develop the self-care deficit theory. She attained her Doctor's of Science degree in 1976 at Georgetown University. Her life ended on June 22, 2007, at the age of 92. Now that we know more about Dorothea Orem, let us discuss her self-care deficit theory. Self-care deficit nursing theory's goal is to help patients achieve the appropriate level of self-care. According to Alligood 2014, self-care deficit nursing theory is comprised of three related theories. The first one is theory of self-care, which comprises of activities performed by individuals to maintain health and wellness. The second one is the theory of self-care deficit. It illustrates why people can be helped through nursing.
Theory of self-care. According to Current Nursing 2020, this theory includes self-care, self-care agency, therapeutic self-care demand, and self-care requisites. Universal self-care requisites. Developmental self-care requisites. Health deviation self-care.
The third one is the theory of nursing systems, which explains relationships that must be maintained to produce nursing. Now, let's first discuss the theory of self-care. According to Current Nursing 2020, this theory includes self-care. This is the practice of activities that individual initiates and perform on their own behalf in maintaining life, health, and well-being. Self-care agency is a human ability which is the ability for engaging in self-care, conditioned by age developmental state, life experience sociocultural orientation, health, and available resources. Therapeutic self-care demand. Totality of self-care actions to be performed for some duration in order to meet self-care requisites by using valid methods and related sets of operations and actions. Self-care requisites. Action directed toward provision of self-care, which has three categories: universal self-care requisites, developmental self-care requisites, and health deviation self-care requisites. Universal self-care requisites. It is associated with life processes and the maintenance of the integrity of human structure and functioning. It is also common to all activities of daily living. It is also identified as the maintenance of sufficient intake of air, water, and food, provision of care associated with elimination process, balance between activity and rest, between solitude and social interaction, prevention of hazards to human life well-being, and the promotion of human functioning. Developmental self-care requisites. This is associated with developmental processes derived from a condition or associated with an event, such as adjusting to a new job or adjusting to body changes. The third one is the health deviation self-care. This is required in conditions of illness, injury, or disease, which includes seeking and securing appropriate medical assistance, being aware of and attending to the effects and results of pathologic conditions, effectively carrying out medical prescribed measures, modifying self-concepts and accepting oneself as being in a particular state of health and in specific forms of healthcare, and learning to live with effects of pathologic conditions. Now, we will be discussing theory of self-care deficit. This specifies when nursing is needed. Nursing is required when an adult, or in case of a dependent, the parent, is incapable or limited in the provision of continuous effective self-care. Orem identifies 5 methods of helping. The first one is acting for and doing for others. The second is guiding others. The third is supporting another. The fourth is providing an environment promoting personal development in relation to meet future demands. And the last one is teaching another. The last topic that is also related to Dorothea Orem's theory is the theory of nursing systems. This describes how the patient's self-care needs will be met by the nurse, the patient, or both. It identifies 3 classifications of nursing system to meet the self-care requisites of the patient. This includes wholly compensatory system, partly compensatory system, and the supportive educative system. The theory of nursing system also defines the design and element of nursing system. It also covers the scope of nursing responsibility in healthcare situations. This also involves the general and specific roles of nurses and patients, the reason for nurses' relationship with patients, and Orem also recognized that specialized technologies are usually developed by members of the health profession. A technology is a systematized information about a process or a method for affecting some desired results through deliberate practical endeavor with or without the use of materials or instruments. According to Alligood 2014, the 5 assumptions of this theory are: human beings require continuous, deliberate input to themselves and their environments to remain alive and function in accordance with natural human endowments. Human agency, the power to act deliberately, is exercised in the form of care for self and others in identifying needs and making needed inputs. Another assumption of this theory is that mature human beings experience privation in the form of limitations for action in care for self and others, involving making of life-sustaining and functioning regulating inputs. Human agency is exercised in discovering, developing, and transmitting ways and means to identify needs and make inputs to self and others. And the last assumption for this theory is that groups of human beings with structured relationship cluster tasks and allocate responsibilities for providing care to group members who experience privations for making required, deliberate input to self and others. Now that we have given you an overview about the self-care deficit theory, let us proceed to the case scenario that we prepared related to this topic and how we can apply it in nursing practice.
Alexia, a 35-year-old female office secretary, was recently diagnosed with diabetes mellitus type 2. The reasons she sought the help of a physician were unexplained weight loss, chronic fatigue, and unquenchable thirst. Upon assessment, she reveals her diet consists of mostly fast food. Additionally, she does not get to exercise regularly due to her work. She mostly deals with paperwork all day long. On her days off, she likes to watch movies at home or reorganize her house.
Alexia is in the office sorting out some files. She suddenly feels dizzy and almost fell out of her chair. Fortunately, her coworker, who is also her friend, caught her. Their boss wanted to call 911, but Alexia said that she will just go after work. However, her boss insisted that she should go now, accompanied by her friend. Upon arrival at the hospital, a nurse saw them.
Alexia's past medical history included only common cough and cold. She has never been diagnosed with any illness, nor has she ever been confined in the hospital. Thus, she viewed herself as a healthy individual. Both her parents only have hypertension. The only person in her family who suffered from diabetes was her maternal grandmother. After learning of her condition, she became anxious and asked if she can still live normally with this diabetes.
Hello, my name is Nurse Elzika. May I assist you?
Yes, please. I feel really dizzy and fatigued.
Okay, let us have you lie down first and let me take your vital sign. Blood pressure is 110/70, pulse rate is 100 beat per minute, respiration rate is 15, temperature is 36.6 degree, oxygen saturation is 100%. Can you tell me more about what happened?
You see, I have been feeling tired for weeks now, no matter how much I sleep or rest. Also, I lost weight even though I eat normally. Additionally, I am always thirsty. But this is the first time that I have felt this dizzy.
Alright, I just need you to lie down here for now while waiting for the doctor. Your friend can stay here with you to make you feel more comfortable. Alright, I just need you to lie down here for now while waiting for the doctor. Your friend can stay here with you to make you feel more comfortable.
Hello, Alexa. I'm Dr. Lucy. How are you feeling now?
I still feel a bit dizzy, but not like before.
Hi, Alexa. I have your results with me right now, and it seems that the sugar level in your blood is higher than normal. When was your last meal?
I last ate at 6 a.m.
This is quite high, which suggests that you may have diabetes.
Oh no, I never expected this.
Silver lining here is that we detected it at an early stage, so it will be easier for you to manage and control with medication, diet, and exercise.
It's good to hear that I can manage it, but how? I know so little about it.
Nurse Alchico can explain to you everything about the disease, the medication, and the lifestyle modifications needed. Then I will see you after 3 weeks.
Thank you very much.
No problem. I'll have Nurse Alchico come in and help you.
Nursing care plan. Assessment. Unstable blood glucose. Deficient knowledge. Risk for ineffective therapeutic regimen. Weight loss. Chronic fatigue. Unquenchable thirst. Imbalanced nutrition. Physical activity deficit. Risk for impaired skin integrity. Anxiety or fear. Goals. The goals of diabetes management are to normalize insulin activity, to reduce the development of complication, to address changes in health behavior and self-care, to provide proper education and information, to increase adherence to treatment regimen, will demonstrate knowledge of diabetes self-care measures, nursing interventions and rationales. Assess the knowledge level of the patient. Patient's knowledge regarding diabetes mellitus and treatment should be assessed, and health education should be planned according to the level of knowledge. Educate patient about home self-glucose monitoring. Glucose monitoring at home helps the patient to identify and manage glucose variations. Provide health education about how anti-diabetic medications work and complications of medications. Information on drugs such as their desirable effects and side effects helps the patient to watch for undesirable effects and seek medical attention as needed. Educate the patient about factors that cause glucose instability. There are multiple factors that may cause glucose instability such as missing meals, infection, or other illnesses. The patient should be aware of that and seek medical help if needed. Educate patient about nutritional management and meal planning. Nutrition, meal planning, and weight control are the foundations of diabetic management. Education on consistent eating habits, relationship of food and insulin, and provision of an individualized meal plan are necessary for nutritional management. Provide education on importance of exercise and weight management. Lack of exercise and sedentary lifestyle can cause insulin resistance and impaired insulin secretion. Excessive weight gain also causes insulin resistance. Educate patient about the complications of diabetes mellitus and medications, and clear all doubts of patient about diabetes and its management. Patients should be aware of the risk factors such as unstable blood glucose level, risk for infection, disturbed sensory perception, impaired skin integrity, and hypoglycemia. Patients should be aware about their disease prognosis, self-care, and treatment needs. Educate about the importance of laboratory investigations and follow-up. Diabetes is a chronic disease which requires ongoing assessment and follow-ups.
Hello, Ms. Alexia. I am here to help you understand your condition and how to manage it. Are you comfortable lying down or did you want to sit up?
I will just lie down because I'm still a little dizzy. Is it okay to have my friend here while we talk? Thank you.
Of course, that is no problem. Whatever makes you comfortable. Now, can you tell me what you know about diabetes?
I only know that it means my blood contains high amounts of sugar. Because I just learned of it today, I'm very scared. I don't know what to expect. Will I die early, or what if I won't be able to do the things that I need and want to do?
All right, I understand that you are very anxious. However, you have to calm down and so you can absorb the things we will talk about today. Why don't you inhale and exhale a few times? Do you want to drink water? That's good to hear. Let us start by knowing about the disease, shall we?
Okay.
Diabetes mellitus type 2 is a condition in which the cells in your body cannot absorb glucose or sugar to use for energy. That is why you have been feeling tired. Also, if blood sugar levels are not controlled, you can be at risk for infections, disturbed sensory perception such as numbness of extremities and blurred vision, and impaired skin integrity. If you get a wound, it may not heal fast.
This is unbelievable. There can be so many complications if I do not control my condition. Also, I just remember that my grandmother also had diabetes.
Yes, that is right. Oh, I see. So you have a family history of diabetes. Thank you for telling me. In some cases, insulin injections are prescribed, but for you, Dr. Lucy prescribed metformin to 500 mg extended release tablet once a day after dinner. This drug helps to lower down your sugar levels. It is important to note that you must not bite nor crush the tablet. You have to swallow it whole. Also, if ever you miss a dose, do not take 2 tablets at once because it can cause you to have low sugar level. Too low and too high levels should be avoided. It is also advisable to have a glucometer at home. It is a small device to measure your sugar level so you know if your condition is improving.
I understand everything except for the glucometer. How do I use that?
So the glucometer. You need to attach the strap to the device, then attach the needle to the lancet. You have to clean your fingertip with alcohol swab before puncturing it. Then the blood needs to go to the tip of the strap. Then the number will show on the screen once it is done calculating. I will provide you with a copy of the glucose values and what it signifies, high, low, or normal.
I think it is best that I have a daily monitoring sheet where I record my glucose levels. Also, should I check in the morning before I eat?
Great idea. Having record is an efficient way to you determine your progresses. And yes, that is the best time to check because you take metformin at night. Furthermore, if you have nausea, vomiting, diarrhea, or metallic taste in your mouth upon taking metformin. Please inform us so we can change your medication.
I got it. I'm not afraid of needles, but it will be very first time pricking myself. Maybe I can watch videos online about it.
That is good idea. Now let us move on to another important topic. As you know, drugs alone cannot control diabetes. A balanced diet and an active lifestyle play significant roles in the management of this condition. Can you tell me what you usually eat and what is a typical day for you?
For 3 years now, I work as an office secretary, so I am usually behind my desk doing paperwork or preparing for meetings. That being said, I don't have time to cook, so I just order fast food for lunch and dinner. For breakfast, I have toast and coffee.
What do you do on your days off?
I clean and reorganize my place, or I go out with my friends to eat.
Do you exercise?
I try to. However, I often just watch a movie, sleep, or go out with my friends. I think of it as a form of reward since I work hard every day.
I see. Fast food and lack of exercise can cause your body to be insulin resistant. Insulin is a hormone that pushes sugar into the cells so it doesn't stay in the bloodstream.
I was wondering if my problem is high blood sugar, can I just skip meals so that I do not have to add more?
Definitely not. Due to the fact that diabetic people can experience really low blood sugar levels faster than anyone else. The goal is to have your sugar level as close to normal as possible. The first step is to reduce your carbohydrate-rich food like rice, bread, pasta, and fast food. Reduce your sweets as well. Focus on eating vegetables and high fiber food. Be careful in eating too much fruits because they also contain sugar.
Okay, to my understanding, you mean home cooked meals, right? I guess I need to make time now for myself.
Yes, that's right. Do you have any questions about diet? If you want, I can refer you to a dietitian to help plan your meal.
No, it's okay. I will try to plan and cook my meals.
That is great to hear. Exercise is important because it helps your body absorb glucose so it can be used for energy.
How long do I need to exercise for a day?
You can start from 30 minutes a day, then gradually increase the duration as you get used to it.
I see. I'm just worried that because I usually get tired after my work and do not have the energy to squeeze in a workout, plus I still have to cook.
That is great to hear. Exercise is important because it helps your body absorb glucose so it can be used for energy.
How long do I need to exercise for a day?
You can start from 30 minutes a day, then gradually increase the duration as you get used to it.
I see. I'm just worried that because I usually get tired after my work and do not have the energy to squeeze in a workout, plus I still have to cook.
I understand your concern, but why don't we take it slow? You can start working out on your days off. After that, if you feel comfortable, you can increase the number of days you exercise. What do you think?
That sounds alright. I will try that.
That's good to hear. Lastly, since diabetes is a chronic condition, it requires continuous follow-up appointments to assess your progresses and adjust your treatment as necessary.
Can I live normally with this long enough to experience life?
With proper management and adherence to your treatment, you can be rest assured that you can work, have fun, and live life to the fullest.
Thank you so much. This means so much to me. I will do my best.
You are welcome. Do not hesitate to give us a call if you have any concerns. We will always be happy to help.
Thank you, really.
No problem. Do you have any questions for now?
No, you explain everything clearly.
All right. We will see you in 3 weeks' time. Take care.
Okay, see you.
Evaluation. Evaluation is needed to check the effectiveness of interventions, patient's level of knowledge on factors that lead to an unstable blood glucose level, and how patient is following the treatment regimen and lifestyle modifications should be evaluated. Alexia came to hospital for her follow-up visit after 3 weeks. She made some lifestyle modifications. She started doing exercise on daily basis and controlled her diet by avoiding fast food and other food which causes high blood sugar. She is monitoring her blood sugar levels by herself and taking medications as prescribed by the doctor. Her level of knowledge on diabetes mellitus and management has been improved, and she is confident about taking care of herself with diabetes to a great extent.
Patients can recover faster and more holistically when they are allowed to meet their own needs, so they can gain and maintain independence if they can do things for themselves. In this case, Alexa learned how to take her medication and change her lifestyle. For the nurse, the first thing she did was to assess the self-care deficit or what the patient required. Then she determined what to teach the patient so that Alexa can gain autonomy. The final goal of this theory is for the patient to provide their own care and become independent.